Hi, my name's Jenna. I'm a student nurse working with Val today. I'm going to put my name on the whiteboard and who I am, who I'm working with. May I have your first and last name, please? Okay, I'm just going to check the wristband and confirm you have any allergies. No allergies? Okay, so I'm here to just do a postpartum assessment on you. So I'm going to ask you some questions. I'm going to be touching on you, looking at you. Do you have any questions before we get started? No? Okay, are you having any pain right now? A little pain on the episiotomy site for sure. So what we recommend every time you urinate, we recommend using like a peri bottle or a sitz bath on that. We also have some numbing spray for that area. Has anyone put any numbing spray on you within the last hour? Okay, you got some numbing spray. What would you say your pain is right now? Okay, it's about a 3. All right, we want to keep that under a 4. So if it ever gets to a 4 or above, just let me know and we can get you some medication or get you some more numbing spray for that. So are you having any dizziness whenever you sit up and try to go to the bathroom? Okay, a little bit of dizziness. So what we recommend is, just waiting for the dizziness to dissipate before you get up and walk. Also, if you feel like you need to, please call me and I will come into the room whenever you need to get up to go to the bathroom or ambulate. And we can just make sure that you aren't, at risk for falling. So I'm going to start by getting your vital signs. I'm going to get your heart rate, your blood pressure, temperature, respiratory rate, all of that. It's all within normal limits, so that's great. So I'm going to auscultate, listen to your heart and your lungs and your bowels, and it's all within normal limits. So I'm going to start with the actual postpartum assessment now. So I'm going to examine your breasts first. So are you having any breast pain? Any like nipple tenderness? Any like cracks or anything so far? Okay, some cracks and some soreness on the nipples. So we do have some cream for that and we can get you some. So I'm going to palpate your breasts just to check for any like clogged ducts in here, which could lead to mastitis, and we don't want that. So I will educate the patient now on doing daily breast exams just to ensure that she does not develop mastitis or get a clogged duct. So when was the last time you fed your baby? Okay, about an hour ago. Next time you feed your baby, please give me a call so I can assess the latch. So the breasts are not red. There's no ducts, no clogged ducts. We'll get her some nipple cream. When was the last time you used the bathroom? Because I am going to be pressing on your belly and I don't want you to have an accident. Okay, so you used the bathroom about 20 minutes ago. Okay, great. So I'm going to move on and I'm going to check your uterus. So I'm going to lift your gown up. Okay. And I'm just going to press on the uterus here. And it feels firm and it's midline at the umbilicus, which is where we'd expect it to be. So I want to ask you about urination now. So are you having any pain when urinating? Some pain from that incision for sure. So like I said, with the peri bottle and the sitz bath, we recommend doing that each time you urinate just to prevent infection and kind of soothe that area. Using that numbing spray also on the incision site can help. Now tell me, have you had a bowel movement since the pregnancy? Okay, so you had one bowel movement and I saw in your chart that you're on stool softeners. So that's good. We want to make sure you stay on those until that incision is healed, just to prevent any tearing. And your bowel sounds are present. Are you passing gas okay? Okay, all right. So now I'm going to take a look at your pad here. How often have you been changing your pad? About once every hour and a half. Okay. Have you noticed any odor with the blood? No odor? Okay, good. If you notice any odor, please let us know because that is not normal and we'll have to take a look. Okay. So now I'm going to have you roll over on your side into the Sims position. So on her like side stomach, one leg up. I'm just going to look at your incision site. And it is a little red, but the edges are well approximated and there's no prelant drainage or anything, no smell. It looks good. It looks like it's healing. I do see a couple small hemorrhoids, which is normal with the vaginal delivery. Are those hemorrhoids bothering you at all? Not too bad? Okay. We do have like some witch hazel wipes and stuff that can help with those. So if you'd like me to get you some, please let me know. Okay, I'll have you roll back on your back here. And I'm just going to check your legs now. Okay. So I'm checking for like warmth and color. And they're warm, and the color is normal. So now I'm going to do the Homan sign. Check. Okay, so I'm going to roll the ankle around and then push it back and let it go. And there's no clonus. Okay, no clonus on either side. So while you're in the hospital, we would like you to at least get up and walk around 3 times a day, just to encourage blood flow in your legs. We don't want you getting any blood clots here. And if you would like someone to come walk with you because you're dizzy, we can totally arrange that. But 3 times a day, we would like you to do that. So tell me about your baby. How do you feel like you guys are bonding well? Is breastfeeding going okay? Okay. So now I saw that you're married. Do you feel like you have good support from your partner at home? Do you have any concerns about, taking care of the baby whenever you get home? No, you're just really excited, ready to get out of here. I totally understand. So the plan for today, we're going to prepare you for discharge. So we do have some discharge videos to have you watch. How do you feel with breastfeeding? Are you comfortable? Do you feel like your baby is getting enough food? The newborn should breastfeed between 8 and 12 times a day initially. Okay, your baby's breastfeeding about 10 times a day. That's perfect. That's what we'd expect to see. And I will assess your latch the next time you feed. And again, it's really important to keep that incision site clean. So yes, peri-bottle, sitz baths, medicated wipes, that numbing spray to help keep you comfortable. That's very important. If you notice any drainage or any smell, or the pain is getting much worse in that incision site, please let us know, because that could indicate infection. And we'll want to get that taken care of. So you don't feel like you need any help with breastfeeding. I do want to ask, it looks like you're up to date on your vaccinations, which is great. Yes, so those educational videos, and other than that, I think that things are looking well for you to go home. Your incision looks great. It seems like you're doing well. So is there anything I can get you right now? Do you need a new pad or some water before I get out of here? No? Okay, well, the bed is low and locked. Call it within reach, 2 side rails up. Her water's within reach. And then how is your pain right now? Is it still at a 2? Okay, good. Let us know again if that gets to a 4 or above, because we'll want to keep that beneath stuff. All right. If there's nothing else I can get for you, I will be back to check on you in an hour.